A very good morning to one and all. My name is Dr. Trophimus, Senior Lecturer from the Department of Pediatric and Preventive Dentistry. Today I will be talking about fluoride varnishes. So these are the contents of my presentation. I'll be talking about the mechanism of action, indications and contraindications, the various types of fluoride varnishes, the advantages and disadvantages, the method of application, and finally the topical fluoride versus the other topical fluoride agents. So what is a varnish? Generally, a varnish is applied onto any surface just to coat it to prevent any damage to it. The same thing applies to this fluoride varnishes onto the tooth. So this is going to help in preventing dental caries to form. Also, it is going to help in retaining the fluoride onto the tooth structure for a long time. And it is also going to have a karyostatic action. So initially in 1960s in Europe, sodium fluoride was first marketed. Later in the 1970s, the silane fluoride became popular. So the main action of this fluoride varnish is going to be anti-caries activities. So fluoride is going to uptake, reaction and release in the enamel are strongly dependent on the duration of contact. So the longer the contact of fluoride is going to be there onto the tooth, the varnish, the better is going to be the action. So how does this fluoride work? So this fluoride varnish, when it's going to be applied onto the tooth surface, it is going to be slowly releasing the fluoride onto the oral cavity. So how does this happen? This applied fluoride onto the tooth is going to act as a depot. So this depot will store the fluoride in the tooth and then slowly release it when there is a need. So what are the indications of fluoride varnish? It can be applied in patients having moderate to high risk of developing caries, caries prevention onto exposed root surfaces, remineralization of lesions in root dentin, and also patients undergoing orthodontic treatment where the molar bands and the brackets are placed. The contraindications of fluoride varnish include children with low risk caries and population where the consumption of fluoridated water is going to be 0.7 ppm or less. It is also seen in cases of ulcerative gingivitis and bronchial asthma, allergy to rosin. So all these are areas where we will not apply fluoride varnish. Moving on to the types of fluoride varnish. So it includes Durafat, Fluor Protector, Durafloor, Cavity Shield, Bifluorid and Fluoritop SR. So the first varnish is Durafat, which was introduced in 1964 by Schmidt. It contains 5% of sodium fluoride. So that is 22,600 ppm. So this is a coliformium based in a natural resin. So once the fluoride varnish is going to be applied onto the tooth color is going to change into an yellowish brown. So the next one is Fluor Protector. It contains 2% difluorosilane in a polyurethane base. It contains 7,000 ppm of fluoride. And this Fluor Protector is available as vials. And this, as you see in this picture, there are 20 vials in one pack. So this can be used for a single patient by breaking the vial and applying onto the tooth surface. Next is Durafloor, which is similar to Duraflat, which is a sodium fluoride base. The only thing is that there's going to be an addition of xylitol to this, and the viscosity is also going to be less here. Next is the Cavity Shield, which contains 5% sodium fluoride. There's going to be a metered dose available in this pack, where each pack contains 0.25 ml or 0.40 ml. So this pack can be unwrapped and then can be used for each patient. The next one is Bifluorid, which contains sodium fluoride and calcium fluoride, this is available as both metered dose as well as in bottles, and each metered dose can be used for a patient for both upper and the lower arch. Fluoritop SR is the next one, which contains sodium fluoride about 22.6 milligrams. Fluoritop has a slow release of fluoride, and there is a study which says that there was a highest demineralization inhibitory effect when compared to Fluor protector and bifluoride 12. Some of the advantages of using a fluoride varnish include these varnishes are available in different flavors, as you can see in the picture. It is easy and quick to apply. It dries immediately once when it comes in contact with saliva. It needs a minimal occupant setting and also has a drastic reduction of step mutant counts over tenfold. Some of the disadvantages include that there's going to be a temporary change, that is an yellowish brown color is going to be seen, and also the cost is going to be high when compared to the other topical fluorides. Next, moving on to the method of application. So initially we are supposed to do an oral prophylaxis for the patient, allow the tooth to dry, and unlike the other topical fluorides, we don't keep cotton rolls because these cotton rolls may stick onto the tooth surface. So we just clean the tooth, keep it dry, and then we apply this fluoride varnish onto the tooth surface. So they say that 0.3 to 0.5 ml is sufficient to cover the full dentition, that is for primary tooth. And first it is preferred that you apply for the lower arch, so that because in the lower arch there's going to be saliva contact pooling. We don't want that to happen, so we finish off with the lower arch and then we move to the upper arch. And even the proximal surfaces can be varnished. So once the varnish is applied for the patient, we are instructed that the patient keeps the mouth open for 4 minutes before spitting, and after that they're not supposed to eat or drink for the next 30 minutes and not take anything solid for the next solid or semi-solids for the next morning. This is because we want the fluoride to be in contact to the tooth surface at least for about 18 hours, and this prolonged contact of the varnish onto the enamel is going to produce better results. So before we conclude, there are a few studies which compare fluoride varnishes with other topical fluoride agents. They've said that fluoride varnishes have better efficacy when compared to the other topical fluoride, which show that there was 50 to 70% caries reduction, and also this topical fluoride varnish is going to be easy to apply and is also effective when compared to the other topical fluoride agents. Thank you.